The prostate is a small gland in the male reproductive system located under the bladder. It's essential in producing fluid that enriches semen, but it may cause issues as men age. Prostate cancer is one of the most common cancers that affect men. Each year, close to 300,000 Americans receive a diagnosis of prostate cancer. About 1 in 9 people with a prostate will receive a prostate cancer diagnosis during their lifetime. This includes men, transgender women, intersex people, and non-binary people with biological male sex organs. While prostate cancer rarely produces obvious symptoms in its early stages, there are a few signs that may signal something is wrong in the prostate. Welcome back. In this video, I will share 11 common signs of prostate cancer. First, let us look at the risk factors for prostate cancer. The most common risk factor is age. Prostate cancer is rare in men younger than 40, but the chance of having prostate cancer rises rapidly after age of 50. About 6 in 10 cases of prostate cancer are found in men older than 65. The second risk factor is family history. Having a grandfather, father, or brother with prostate cancer more than doubles a man's risk of developing prostate cancer. However, it is important to note that most prostate cancer occur in men without a family history of the disease. The third risk factor is race. Prostate cancer develops more often in African American men and in Caribbean men of African descent than in men of other races. So, what should you be on the lookout for? Knowing the symptoms of prostate cancer will help you keep an eye for any concerning changes to your health. Keep in mind though that these symptoms may not indicate trouble with your prostate. And in fact, most all of them come standard with aging. But if you experience several symptoms or have other concerns, it may be a good idea to visit a urologist. Number 1 is painful or burning sensation during urination or ejaculation. For some men, ejaculation could become painful. It could feel more like burning sensation or sharp pain or dull but noticeable ache. Number 2 is frequent urination, especially at night when you are laying down. This can be due to a tumor on the prostate putting pressure on your bladder and urethra. Number 3 is difficulty stopping or starting urination. Number 4 is slow or weak flow of urine. And number 5 is trouble emptying the bladder completely. Number 6 is sudden erectile dysfunction or reduced ejaculation. Apart from discomfort during ejaculation, prostate cancer could also lead to a smaller volume of ejaculate. Although this is also a common effect of aging, it should cause some concern when accompanied by other symptoms of enlarged prostate. Number 7 is blood in urine or semen. Blood in your urine or semen might not be too obvious because it isn't always bright red. Often, you'll notice a brown or dark orange color that could also come with changes in smell. Although blood in semen and urine is not always a sign of cancer, it is still something that needs medical attention. Number 8 to 11 is for men with advanced prostate cancer. These symptoms may occur in cases where their primary cancer has spread from the prostate to other parts of the body, such as bones, lungs, and lymph nodes. Number 8 is pelvic, back pain, or stiffness in the back. Men with prostate cancer often complain of pelvic pain. Sometimes that pain could radiate around the thighs, back, and hips. That makes it uncomfortable to stay seated for long periods. Number 9 is loss of bladder or bowel control. An enlarged prostate or tumor could put pressure on the rectum and bladder, which might cause loss of bladder and bowel control. Number 10 is edema or numbness in the feet. Prostate cancer could cause tumor growth that affect the bones or press on the spine. As it progresses, it could affect your legs and cause swelling, pain, or even loss of sensation. And lastly, number 11 is weight loss and fatigue due to loss of appetite. The symptoms of prostate cancer may be different for each man, and any of these symptoms may be caused by other conditions such as benign prostate hyperplasia or BPH. BPH can cause many of the same symptoms as prostate cancer, including pain while urinating, frequent urination, difficulty starting or stopping urination, and bloody urine. Another condition is kidney stones. Like prostate cancer, kidney stone can make it painful to urinate and lead to bloody urine. The third condition is urinary tract infection or UTI. Although UTI most frequently occur in women, they are also very common in men. They can cause painful urination as well as strong urge to urinate despite not being able to produce much urine. And lastly is prostatitis. This is when the prostate gland becomes inflamed due to an infection or an injury and can cause painful and difficult urination. What to do if you have signs of prostate cancer? If you are displaying one or more signs of prostate cancer, be sure to promptly consult with a physician. And like most other cancers, prostate cancer is usually more easily easily treated when it is detected at an early stage. When you visit an experienced medical provider, they will be able to pinpoint exactly what's causing your symptoms and recommend the course of treatment that is best suited to your specific needs. Thank you for watching. If you liked the video, please share with your friends and please subscribe to our channel if you haven't already done so. If you want to be notified of our new upload, click on the bell icon to turn on your notifications. Until next time, stay healthy and remember, health is the greatest wealth.